Hello, I'm Dr. Shawn Dhillon. As a primary care provider in practice for over 15 years, I learned early the impact we can make in treating and managing dyslipidemia. For patients with dyslipidemia and type 2 diabetes, the selection of an efficacious statin can pose a challenge given that blood glucose levels must be carefully managed in these patients. Additionally, these patients often present with and may be receiving treatment for additional comorbid conditions. During this presentation, we'll review clinical data for LIVALO to get a better understanding of this efficacious statin, its safety profile, and how it may be an appropriate treatment option for your patients with dyslipidemia and type 2 diabetes. Let's begin by looking at efficacy and important safety data from a clinical trial of LIVALO versus atorvastatin in adult patients with combined dyslipidemia and type 2 diabetes. In this clinical trial, with respect to LDL-C, LIVALO 4 mg was not statistically different from atorvastatin 20 mg, with reductions in LDL-C of 41% and 43% respectively. Additionally, related to safety, looking at mean percent changes in blood glucose from baseline at week 12, LIVALO 4 mg demonstrated a non-significant 2.1% change in blood glucose, while atorvastatin 20 mg was associated with a statistically significant 7.2% increase in blood glucose. Let's now turn our attention to efficacy data from another pivotal trial evaluating LIVALO versus atorvastatin in adult patients with primary hyperlipidemia or mixed dyslipidemia. As shown in this slide, LIVALO 2 mg and 4 mg demonstrated LDL-C efficacy comparable to atorvastatin 10 mg and 20 mg, respectively. Treatment differences demonstrated that LIVALO had similar LDL-C efficacy to atorvastatin. Additionally, LIVALO demonstrated reductions in other lipid parameters, including ApoB and triglycerides. I hope you take away from today's discussion that for your patients with dyslipidemia and type 2 diabetes who need potent treatment options for elevated LDL-C and for whom certain safety parameters, particularly blood glucose levels, are important considerations, LIVALO may be an appropriate choice. Thank you for taking the time to view this important treatment information.